Ladies, I have to tell you something that may be hard to hear, but once you know the truth, you'll never walk into a doctor's office the same way again. As a doctor who's spent over 30 years in the medical field, I've seen firsthand how older women are often misunderstood, ignored, and even disrespected by healthcare professionals. And today, I'm pulling back the curtain. What do doctors really think of older women? What are they saying behind closed doors? And why are so many of them making dangerous assumptions that could actually cost you your health? Or worse, stick with me until the end, because I'm going to reveal the one red flag phrase that doctors use when they've secretly decided not to take you seriously. Backhand index pointing, right? And before we dive in, don't forget to like this video, subscribe, and comment below. Have you ever felt dismissed by a doctor? I want to hear your stories. Part 1. They assume you're just old. This is by far one of the most harmful mindsets I've seen in the medical world. The moment an older woman walks into the room, many doctors immediately filter everything she says through one biased lens. She's just old. That's it. That's the diagnosis. End of story. It's absolutely infuriating. You say your knees hurt. Must be arthritis. You say you're tired all the time. Probably just age. You say your memory's a bit off. Oh, don't worry. It's just what happens. That kind of blanket assumption leads to one thing: neglect. And it happens all the time. I've watched brilliant, vibrant older women come in with real medical concerns, serious ones, only to have them brushed off with a casual smile and well, that's to be expected at your age. But what these doctors won't tell you is that age is not a diagnosis. It's a factor, sure, but it's not an excuse to ignore red flags. I had a patient, Joan, in her early 70s. She came in with chest discomfort, nausea, and dizziness. She was told it was indigestion. Just watch your diet, they said, but her gut told her something was wrong. She kept pushing, and eventually another doctor ordered an EKG. It turned out she was having small, repeated cardiac events. She could have died, but if she hadn't insisted, if she had trusted that first dismissive answer, her story might have ended in tragedy. This assumption, that symptoms don't matter because they come from an older body, is not just ageist, it's dangerous. Fatigue could be a sign of heart problems. Memory loss could point to a vitamin deficiency or early dementia. Joint pain could be autoimmune. Pain is not a personality flaw. It's not whining. And it's not something to tolerate just because you're over 65. And yet, the moment you reveal your age, many doctors downgrade the urgency of your complaints. There's almost an unspoken policy. You've lived a good life. What more do you want? That attitude disgusts me. Your life, your comfort, your clarity, they still matter, no matter your age. And if your doctor isn't willing to treat your symptoms like they treat a younger patient's, you need to find someone who will, because it's not just old age. Sometimes it's something real. Sometimes it's something treatable, but it will never be discovered if no one bothers to look. Part 2. They think you're not tech savvy, so they don't explain. Let's talk about another deeply rooted assumption. Doctors often think older women don't understand technology. And because of that, they assume you won't follow complex instructions or comprehend the latest treatment protocols. So what do? They stop explaining. They stop educating you. They give vague advice, like just take this twice a day, without telling you what it is, how it works, what side effects to look out for, or why you're even taking it in the first place. I've seen this so many times, it makes my blood boil. You might ask, what does this medication do? And they'll wave you off with, oh, it's just something for your blood pressure, as if that's a full answer. But would they be that lazy with a 35-year-old? Probably not. I know plenty of older women who can run circles around me when it comes to organizing, budgeting, researching, and even using apps. But doctors assume that if you're over 65, you don't own a smartphone, you don't understand My Health portals, and you can't possibly navigate a treatment plan. So instead of including you in your own healthcare decisions, they dumb things down. They make the decisions for you. They move quickly. They don't send follow-ups. They don't even ask if you understand what's happening. And the problem with that, you go home confused. You try to remember what they said, but it was rushed and jumbled. You feel silly calling back because they made you feel like you wouldn't get it anyway. So you stay quiet. You miss a dose, or take the wrong one, or have a side effect, and don't know if it's normal. And you know what happens next? They blame you. They say you weren't compliant, that you didn't follow instructions. But the truth is, they never respected you enough to explain things properly in the first place. Medical information should never be gatekept, and it certainly shouldn't be simplified to the point of being useless. You're capable, you're intelligent, and you have every right to understand what's going on with your body. So the next time a doctor speaks to you like you're a child or skips over the details, speak up. Say, I want to understand this fully. Don't let them rush. Don't let them assume. You deserve real explanations, not just instructions. Part 3. They underestimate your pain. This one cuts especially deep for me as a doctor, and as a woman. There's a long, shameful history in medicine of dismissing women's pain. It's rooted in old-fashioned beliefs that women exaggerate, are overly emotional, or are just too sensitive. And when it comes to older women, that problem multiplies. I've seen women in their 70s and 80s describe severe, debilitating pain, only to have a doctor glance up and say, "Let's monitor it." That's code for, "I don't believe you." Or worse, "You're too old to do anything about it." Anyway, that is unacceptable. Pain is not a weakness. It is not something to put up with just because of your age. And yet, many doctors assume that older women should just endure it, that you're used to discomfort, that if you're complaining, it must not be that bad. Let me tell you about a woman named Rita. She was 76, still active, still gardening, still walking every day. But she began having sharp pain in her hips and pelvis. Her doctor told her it was probably arthritis. "Everyone your age has it," he said. No imaging, no testing, no referral. 3 months later, she came to me for a second opinion. I ordered scans immediately. She had a fractured pelvis. It had worsened while she was walking around on it. That pain she was feeling, it was real, and it was serious, but it was brushed off as typical. That story is not rare. Another woman had persistent abdominal pain for months and was repeatedly told it was constipation. When someone finally ordered proper tests, it was advanced ovarian cancer. Could earlier detection have helped? We'll never know. But the delay cost her dearly. When you're older, your pain might be more complex, but it is still valid, and it demands attention. If your doctor doesn't take it seriously, doesn't ask follow-up questions, doesn't offer next steps, and doesn't seem to believe you, it's time to walk away. Find someone else. Because you know your body. You know what feels normal. And you know when something's wrong. No one, not your age, not your gender, should ever be a reason for your suffering to be ignored. Part 4. They assume you're not sexually active, so they skip important screenings. Now, this one might shock you or make you angry. Either way, it needs to be said. Many doctors, especially male doctors, have this outdated, completely false assumption that once a woman passes 60, she's no longer sexually active, that her sex life just vanishes. And because of that assumption, they stop asking questions. They stop checking in. And they stop offering the screenings and treatments that could make a huge difference in your well-being. But here's the truth. Older women still have sex. Some are in long-term marriages. Others are dating again after divorce or widowhood. Some are discovering their sexuality in new ways. But none of that matters to a doctor who thinks intimacy disappears after menopause. So what happens? They stop testing for things like sexually transmitted infections. They stop asking about discomfort during intimacy. They skip pelvic exams. They don't bring up vaginal dryness, atrophy, or hormonal shifts. They act as if these concerns are no longer relevant or too awkward to talk about. That silence has consequences. One of my patients, a 68-year-old widow named Celia, had started a new relationship after being single for years. She was thrilled, a bit nervous, and finally feeling that spark again. But after a few months, she developed pain and bleeding during intimacy. Her doctor waved it off and said, "That's just part of aging. Nothing to worry about." He didn't examine her. He didn't ask questions. She came to me 6 months later in distress. I ran the tests and found untreated infections, severe atrophy, and early signs of tissue breakdown. Things that could have been managed if someone had simply acknowledged that, yes, older women are still sexual beings. The problem isn't just medical. It's deeply cultural. When you become a senior in society's eyes, you're expected to disappear, to become invisible. But your needs, your body, and your pleasure don't vanish with a number. And any doctor who ignores that isn't doing their job. So here's what I tell every woman. If your doctor doesn't ask about your sexual health, bring it up yourself. And if they seem uncomfortable or dismissive, find someone else. You have the right to full, respectful, age-inclusive care. And you should never be made to feel ashamed of wanting to live fully, love deeply, and care for your whole body. Part 5. They assume you're not worth the aggressive treatment. This one is harder to talk about because it's where ageism and medical ethics collide. I've seen it more times than I can count. A woman in her 70s or 80s presents with a serious condition, maybe cancer, maybe a heart issue, maybe something with her lungs or kidneys. The options are laid out. Surgery, a newer medication, a more involved treatment plan. But then the doctor says something like, "Well, at your age, we don't usually recommend that." Or, "It's probably not worth the risks at this stage." Or worst of all, "Let's just keep you comfortable." Now don't get me wrong. Sometimes those statements are medically sound. Sometimes gentler, less invasive options really are the best path. But what I've seen far too often is this. The decision is made before the conversation even starts. The assumption is that you don't want to fight, that you wouldn't tolerate the side effects, that your remaining years aren't valuable enough to justify the cost, time, or effort of more aggressive treatment. And here's the worst part. They make that call without asking you what you want. They rob you of the opportunity to choose. I had a patient, 74 years old, who was diagnosed with breast cancer. Her doctor suggested doing nothing beyond hormone pills. He didn't offer surgery, didn't refer her to an oncologist. Why? Because, as he later admitted to her daughter, she's not young. We want to keep things simple. But this woman had been running her own business for 40 years. She was healthy, active, and had plans to travel the world. Simple wasn't what she wanted. She wanted to live. And when she finally got to a specialist, she had surgery, recovered beautifully, and is now cancer-free 4 years later. That's what can happen when you're given the choice. So let me say this clearly, you are not a burden. Your life is not less worthy of care. You deserve to know all your options. You deserve to decide how aggressively you want to fight, whether you want to extend your life, improve your quality of life, or simply understand all the facts. That is your right. If a doctor decides for you without your input, they are not respecting you. They are writing you off. And that's not medicine. That's discrimination. Part 6. They think you're set in your ways. Let's move to something a little more subtle, but just as damaging. A lot of doctors, whether they'll admit it or not, don't believe older women are willing to make lifestyle changes. They assume you're stuck in your habits, that you've already made up your mind about how you eat, move, sleep, and think. So what do? They skip the conversation altogether. They don't talk to you about strength training, even though it's one of the most powerful tools to keep you mobile and independent. They don't discuss nutrition even when your energy is down or your weight's changing. They don't suggest new approaches to sleep, cognition, inflammation, or mood. Why? Because they've already decided you won't change anyway. That mindset is incredibly short-sighted, and frankly, it's lazy. I've had 80-year-old women in my office who were more motivated than 30-year-olds, women who started lifting light weights and improved their balance, women who gave up sugar and reversed their prediabetes, women who began journaling and saw their blood pressure drop. But if a doctor walks in thinking you're set in your ways, they won't even give you the chance. It's a form of quiet discrimination, so quiet that you might not even realize it's happening. You're being denied the opportunity to grow, improve, heal, and evolve just because of someone else's low expectations. And let's be real, this attitude trickles into everything. Doctors will spend 20 minutes talking about lifestyle with a younger patient, but give an older woman 5 rushed minutes and a prescription, because in their mind, she's not going to change. So why bother? But here's what they're missing. Older women are some of the most resilient, resourceful, and capable people I know. You've raised families, built careers, endured losses, survived illnesses, and reinvented yourself more times than most people will in their entire lives. You are not stuck. You are strong. And if someone believes in you and gives you the tools, you can change your life at any age. If your doctor doesn't believe that, they don't know you, and they don't deserve you as a patient. Final reveal, the red flag phrase doctors use. Remember I said, I'd tell you the one phrase that should make you run? It's this. Let's just keep an eye on it. With no plan, no timeline, no follow-up. If they say that, and they haven't ordered tests, referred you, or explained why, then they've mentally filed you under not urgent, not serious. You deserve answers. You deserve to be taken seriously. Don't let anyone stall your care with vague promises.